This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how you know if you have frozen shoulder. So the short answer is, you know if you have frozen shoulder if you can't move it and it's really, really stiff. And not only you can't move it, but somebody else also can't move it. So you've lost active, meaning you moving it, and passive, meaning someone else moving it, range of motion. So what frozen shoulder is the shoulder joint is surrounded by a capsule, which is kind of a thick whitish layer. And in frozen shoulder, that capsule gets really inflamed and gets really stiff. And what ends up happening is somebody loses the range of motion in their shoulder. Now, sometimes this can come from trauma, but a lot of times it comes without, we don't really know why. So we'll call it idiopathic, meaning it just happened. You see it more in diabetics or people with low thyroid. So there's probably something that's associated with it there. But basically, most of the time, it just kind of starts on its own and goes through different phases. The first phase is the freezing phase. This hurts a lot. That means not only is it getting stiff, but it hurts a lot. Eventually it goes to the frozen phase where it doesn't hurt a lot, but it's stiff. And then after that, it eventually goes to the thawing phase where the range of motion will eventually come back on its own. The problem is that can take years without any sort of treatment. So you'll know if you have frozen shoulder if you start off with pain in your shoulder, pain's gone away, and you just can't move it and it's stiff. Really, the best thing to do is we'll often do steroid injections, one above the shoulder joint and one in the shoulder joint. That will take someone from the freezing to the frozen stage and then get them in a course of physical therapy to do light range of motion, or they can do it at home to get the range of motion back. Rarely, if that fails, we'll have to do a manipulation under anesthesia where we put them to sleep and move their arm. And then rarely, if that fails, then sometimes we'll do shoulder scope surgery where you actually release the capsule itself. But yeah, if you've had shoulder pain and you're older, or you just had some trauma to your shoulder, or you're diabetic or low thyroid and you can't move it and it's really, really stuck, you probably have frozen shoulder, and then you can do the things that I talked about earlier. So I was able to answer your questions about how do you know or what to do if you have frozen shoulder, or how do you know if you have frozen shoulder. If there's any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. If you like this video, we put out new content every week, so please like and subscribe, and thanks for watching.